Welcome back, everybody. Breast cancer screening can be life-saving, albeit expensive. So let's chat about who needs them, when, and is there a low-cost option here locally? Well, joining us now with all of those answers and a lot more on this Wellness Wednesday is registered nurse Laura Scherling. She's a breast patient nurse navigator for St. Mary's Regional Medical Center. Laura, thanks so much for being with us. Obviously, a very important topic. Some new information out recently, but let's get straight to it. What is it? Why is it rather important for women over 40 to get that annual mammogram?
Early detection is key because if we treat it earlier when it's smaller and less invasive, much better prognosis. So definitely important to do your annual mammogram.
So there's the question of who and then at what age. Why is it at greater risk for developing, or I should say, who is at greater risk for developing breast cancer? Is there something that differentiates one woman from the next?
Greater risk is actually after age 55 particularly goes up. The older you are, the higher risk, although genetics certainly play into it, as well as obesity, lack of exercise, and family history.
Why aren't women under the age of 40 required to have annual mammograms? You would think if early detection is so important, why not start it earlier?
Earlier, women have dense breasts, and we can't see. It looks like it's looking for a snowball in a snowstorm. It's very difficult to see. So that's not a good test for them, but they do need to have clinical breast exams yearly from their physician.
So if their family has a history of breast cancer, would that be something to say to someone, well, you know, maybe if you are under the age of 40, we should start screening if it is something that runs in your family?
Yes, you actually should see the doctor, and there is genetic testing that can be done, and also those women sometimes are amenable to having MRIs done on their breast because they can see the dent through the dents.
Okay. How about uninsured and low-income women? How about obtaining some low-cost screening? Because it can be pretty pricey.
Yes, St. Mary's is offering a program for uninsured folks to have a mammogram for $100 through the end of this year.
Lori, thank you so much. We've got that information there up on our screen again through December 31st. Get a hold of St. Mary's if you'd like to get some more information on that, and you can find it on our website as well, mynews4.com. Lori, thanks so much for being with us. A lot of great information.